Walk into almost any medical office in America today, and chances are you'll still hear the screech of a fax machine. Lab results, referrals, records, prior authorizations, all flying through a phone line like it's 1998. It might surprise you that healthcare, which otherwise boasts robotic surgeries and cutting-edge diagnostics, still relies heavily on a technology most industries buried a long time ago. But here's the thing, fax isn't a bug, it's a feature. Blaming doctors for refusing to move on isn't just lazy, it misses the real story. Welcome to PCP Lens, where we journey through metrics, money, and madness. My name is Sudeep Bansal, I'm a primary care physician in Connecticut, and I run my own practice. In this video, I'm going to break down why fax remains dominant in healthcare, what's been tried to replace it, and why those efforts keep falling short. Let's dive in. First and foremost, traditional fax is allowed by HIPAA. Fax is a direct communication method between the sender and the receiver without any intermediate storage, similar to USPS. This means that fax is exempt from HIPAA security rule, which regulates the handling of protected health information. It still, however, falls under the HIPAA privacy rules, which means that both senders and receivers need to take reasonable measures to ensure that the information is protected and will not be disclosed to others. eFaxes, though, do fall under the HIPAA security rule, as an intermediate entity stores the fax, even if it's temporary, before it is forwarded to the recipient. First, fax is universally accepted, and everyone working in healthcare has a fax number, and they rely on it. This means that a medical office can fax the medical records, and the chances are pretty high that the other office will get the records. Next, fax numbers are relatively easy to find. They're now built into directories in the electronic health records, or they're publicly available on the provider's website. All the office staff has to do is Google the doctor's name, and they'll find the fax number. Next, fax gives the office the ability to manage all incoming and outgoing faxes in a centralized workflow, where any staff member can send or receive faxes and act upon that information. Fax is an inexpensive option to set up and maintain compared to point-to-point integrations. Paying electronic health record vendors tens of thousands of dollars to integrate your EHRs to the various labs and radiology centers is just cost prohibitive. While manual faxes are not integrated directly into electronic health records, most EHRs today make it very easy to scan the document without much staff training. Now, don't get me wrong, manually sending faxes and receiving faxes has many problems, including the dreaded "we never received the fax." And you can see the long flowchart on the slide on how convoluted this manual faxing workflow is. In spite of that, it is still the most reliable technology that we have. By the way, if you're interested, you can see the entire flowchart on PCPLens.com. eFaxes have completely changed the landscape. They enable a paperless workflow within the electronic health record system, and in most EHRs, the office staff can select the medical chart or the order, look up the name of the doctor from the inbuilt directory, and hit fax. That's it. On the recipient side, the fax is received in the EHR inbox for the staff or the doctor to review based on software settings and the EHR workflow. This workflow has eliminated the need for physical paper in most cases, improving efficiency. eFax therefore maintains the familiar faxing workflow, especially easy to find fax numbers that staff already know, while adding the benefits of a digital solution. You can see the flowchart on the side on how much simpler eFax workflow is compared to a manual fax workflow. Now, you may be wondering that there has to be some technology that can replace fax. Well, there are three main technologies that have tried or are trying to replace fax: health information exchange to share data, HIPAA-compliant email, and something called FHIR and API, which allows for direct system-to-system communication. Let's look at each of these one by one. The first is health information exchange, or HIE. HIEs were designed as pull systems. That is, doctors need to actively search for records in a separate tab in the electronic health record or in a different software altogether. They were designed to share data, not replace fax. Besides this, there are several other limitations of HIEs. First is incomplete coverage. Not all healthcare entities share data with HIE, including many medical practices, labs, and radiology centers. Second, when data is shared, it may just be limited to demographic information, essentially rendering it useless for medical use. And lastly, HIEs cannot handle sending and receiving orders such as referrals or even prior authorizations, which still requires fax. Now let's look at email. We get this all the time. Why can't I just email you? Well, first and foremost, regular email services like Gmail or Outlook, they're not HIPAA compliant. Therefore, everyone working in the healthcare system needs to use a secure email service provider, such as ProtonMail, or use a software that acts as a wrapper around an existing email provider, such as Mimecast or Proofpoint. Then, the healthcare provider also needs to sign a business associate agreement. Now, using a HIPAA-compliant email is enforceable. Healthcare organizations have also been using HIPAA-compliant emails for business use cases. However, it creates big problems when used for frontline care delivery, both for the sender and for the receiver. If you've ever received an encrypted email from outside your organization, you know how frustrating that can be. You have to log into multiple secure portals just to access your email. Also, you need to constantly create new passwords or change your existing passwords to access your secure email, which is a nightmare. And then, if you want to keep that email as part of your record, you have to print and scan it to ensure that you have a legal copy. Now, imagine that you're working in a medical office and have to perform this workflow hundreds of times almost every other day. You can see from this long flowchart how convoluted the secure email workflow is, and it's a non-starter in a busy medical office. The government tried to fix the fax problem by forcing all electronic health records to implement what's called a secure email in EHRs, which is also called a direct message. However, direct message has several limitations. First, it has limited adoption and is still not universally accepted. Even though EHRs are required to build this functionality, your local lab and radiology center probably does not use a direct message. Good luck sending orders to them. Again, there's no provider directory and hard to find direct email addresses. This is slowly getting better as CMS now requires all medical providers to add their direct address to their profile. Then EHRs still bury this functionality and it is extremely hard to find and use. And lastly, for some places that are using direct addresses, all the information comes directly to the doctor instead of going to the staff for triaging. This leads to inbox overload and burnout. The newest, or the not so newest, kid on the block is something called FHIR. The hope is to couple this with a technology called API to finally get rid of fax. FHIR stands for Fast Healthcare Interoperability Resource. It defines what healthcare information looks like, that is the language and structure of data. Essentially, data is exchanged using standardized data elements in a structured format. However, it is currently being used mainly as a pull model, that is, the doctor has to go and retrieve information. APIs, on the other hand, define how information travels, that is, the secure road systems for exchange. It allows for point-to-point secure connections, but requires all medical systems to be compatible. FHIR-based APIs do have the potential to replace fax in the future, especially with the adoption of a push-based workflow. Now, if we move away from fax, we need to realize that there's a huge catch. Currently, healthcare data is locked into electronic health records, and the most reliable way to exchange the data is via fax. As adoption increases, FHIR-based APIs will be able to retrieve data from the electronic health record and provide open access to multiple other apps and services. This means that the API gateway needs to connect to hundreds of medical systems. The vendors that do it well will eventually control access of the data. FHIR-based APIs have the potential to modularize the exchange of healthcare records, but they can also create opportunities for new monopolists, those who control API access points, mirroring Clayton Christensen's cycle of integration and modularity. Healthcare risks swapping an old EHR monopoly for a new API gateway monopoly. In conclusion, fax has a near 100% adoption rate in healthcare and a strong network effect. To get rid of fax, the two biggest challenges are optimizing workflow for frontline healthcare professionals and solving for the network effect. But creating a new network from scratch is really hard. Even these fancy new technologies and the fancy acronyms don't rule out fax as the technology of the future. eFax is the modern evolution of plain old fax, and the integration of eFax and AI should eliminate any challenges with standardization and communication protocols. Organizations don't have to reinvent the wheel because eFaxes with AI will be good enough. Expect this modern, evolved eFax technology to be with us for a really long time. You can find a written version with references to the material in an audio podcast version on PCPLens.com. If you like this video, please sign up on PCPLens.com so that you don't miss the next episode when it's published. Thank you for watching. Take care. Goodbye.